Welcome back. Although seemingly harmless, snoring can have a big impact on your health. It can lead to heart failure, and if left untreated, can raise the chance of congestive heart failure by 58%. So joining us today to discuss this is Dr. Vivek Goswami. He's a cardiologist at Austin Heart who practices at Heart Hospital of Austin. So glad to have you with us.
It's nice to be here.
You know, people think about snoring as just a nuisance. It's an issue for couples, but it's something even more serious, right?
Sure, yeah. I mean, let's be honest, very few patients get excited when their doctor recommends a sleep study, and they're even less excited to have the sleep apnea treated if they do have significant disease. But it's very important. I mean, up to 1 in 4 men can have sleep apnea, 1 in 10 women. And if untreated, sleep apnea can triple the risk of an individual having a heart attack. It doubles the risk of individuals developing atrial fibrillation. Many people with high blood pressure have high blood pressure because they have underlying sleep apnea. It more than doubles the risk of developing congestive heart failure, which is a progressive terminal condition, and it doubles the risk of individuals dying suddenly while they're sleeping. Some studies even show the risk of getting in a car accident if you have untreated sleep apnea is similar to someone who's driving while intoxicated.
Really?
So there's a lot of downstream adverse health effects of untreated sleep apnea. So if your doctor does recommend a sleep study, we encourage people to follow through with it.
Okay, but let me back up just a bit because we went from snoring to sleep apnea. Let's talk about the connection between the two.
Yeah, excellent question. So when we fall asleep, when an individual falls asleep, all their soft tissues and muscles relax. Well, the muscles in the throat are of no exception, and if these throat muscles relax, they can actually create an obstruction, and that's what creates that audible snore. Is that obstructive flow through the throat, and it can even transiently cause an individual to stop breathing. And if an individual stops breathing due to that obstruction, it induces a very important mechanism, a fight or flight mechanism, an adrenaline surge, which almost wakes the patient up so they can start breathing again. This cycle repeats itself again and again throughout the night, and over time it can cause a lot of stress on the heart and various other organs, and it leads to all those downstream health consequences I mentioned. So it's a very important thing, and importantly, the individual that has sleep apnea, oftentimes and most times they don't realize it. So sometimes a bed partner can say, you know, he or she may snore at night, or they may stop breathing transiently, but because the individual that has the sleep apnea doesn't necessarily wake up all the way, they would never know.
Okay, so, you know, you're not recommending everyone have a bed partner, but certainly be in tune with your body. And if you do have a partner, let them know if you notice something that is out of sorts. But if it's just you and you find yourself waking up in the middle of the night, not feeling rested, feeling like you stopped breathing, then you encourage a sleep study, right?
Certainly, yeah. So if a bed partner says that an individual snores, if you're feeling daytime somnolence or fatigue, if you have high blood pressure, atrial fibrillation, these are things that predispose or have a high likelihood of the individual having sleep apnea, and they should be tested. That's the only way to know for sure.
And it's so important to do that because, like you said, it could be deadly. So for your own health, make sure you get tested. Thank you so much for being here once again.
I appreciate the opportunity. Thank you.